Thank you all for coming. I know many have made long trips to be here with us today to celebrate this unique rite of passage. It is my great honor to welcome you to the Warren Alpert Medical School's 19th annual Ceremony of Commitment to Medicine. And now it is my pleasure to introduce Dean Jack Elias. Dr. Elias is the Senior Vice President for Health Affairs and the 7th Dean of Medicine and Biological Sciences at Brown. A preeminent physician scientist, he brings to his role decades of experience as a National Institutes of Health funded researcher, a clinician specializing in pulmonary medicine, and chair of the Department of Medicine at the Yale School of Medicine. Dr. Elias is a member of the National Academy of Medicine and served as president of the Association of American Physicians. In a professional career spanning more than 30 years, Dr. Elias has cared for patients with a wide variety of lung ailments and injuries and has conducted research on conditions including asthma, chronic obstructive pulmonary disease, pneumonia, pulmonary fibrosis, and the effects of smoking. His NIH-funded lab focuses on cellular and molecular biology of lung injury and repair. He earned his bachelor's degree and medical degree at the University of Pennsylvania, served an internship at Tufts New England Medical Center, and completed residency in medicine and fellowships in both pulmonary and critical care medicine and allergy and clinical immunology at the University of Pennsylvania. Please join me in welcoming Dean Elias.
Thank you very much, Daniel, and I wish all of you could see what I see. This is a tremendous, tremendous view. Every seat is taken, and we're about to do something very, very, very special. As the Dean of the Medical School, I want to thank and welcome the parents, family members, spouses, significant others, and friends to your loved one's white coat ceremony. But I especially want to congratulate the class of 2021 for getting to this part. Let's give them a round of applause. You are the largest class that the Alpert Medical School has ever had. You are you're 144 strong, and we only have 150 seats in the auditorium. So this may be the biggest class we ever have, unless we build a new building. You come from 30 different states. You come from the District of Columbia. Some of you a number of months ago were in college, and some of you a number of months ago had other careers. In this group, we have people who have been in the Peace Corps, people who worked for NASA, people who have owned businesses, people who have served our country in many different ways, and yes, we even have one opera singer. But wherever you've come from and wherever your background has led you to, today is a very special day because you're entering the best profession in the world. Today, when I place the white coat on you and welcome you to the world of medicine, it's a beginning of a new process in your life. It is both a privilege and a responsibility. It's a privilege, the privilege of being a trusted advisor for the lives of your patients. You will hold their secrets. You will be with them on numerous occasions, and you'll be with them through both good and, unfortunately, through bad. You will also have and take on a grave responsibility. You will be committed to keep your patients safe, to make them well, and to always put their welfare first, even before your own. You're going to have great days. You're going to have some days where you really understand the impact of being a healer for your patients. On the other hand, you're going to have some bad days. You're going to have days where you look up to the sky and go, why did this happen? The trick to that, however, is going to be that you need to look at everything that you do and everything that goes on, and you need to keep working and striving to do better and do better and do better as your career goes forward. What I'm really saying to you is that this is not the beginning of the end. This is the beginning of a lifelong commitment to learning. Every one of you now has to become a lifelong learner as you go forward with your careers. Now, one of the joys of being able to address the class this way is that I get full attention. Cell phones are off. People are paying attention, and so I get to make a few suggestions of things that I'd like to have you take with you over your next 4 years. The first point I want to make for all of you is that this is a chance for you to find your passion. You're going to have tremendously broad-ranging experiences as you go forward. You need to jump in with both feet into every experience that comes your way, and you need to participate with gusto. You need, over the next 4 years, to find your niche in the broad world of medicine. That's an extremely simple concept, but it's an extremely difficult concept. You need to get yourself to the point where when you wake up every morning for the next 20, 30, maybe God willing 40 or even more years, and you're about to walk out the door to do X, X should put a smile on your face. If X puts a smile on your face when you're about to go out and do what you've been trained to do here and in subsequent training, then you've used your time wisely and you've gotten to where you need to be. Point number 2, listen to your patients. They have a story to tell you, they have a history to share with you, and they are your partners in the entire endeavor. You can't really be successful as a physician unless you listen to your patients. The third point that I want to bring forward to you is that you need to commit yourself to advancing knowledge. It's your responsibility to ensure that the next generation of physicians has new and more effective treatments for their patients than we do now. You're going to learn a lot of therapies as you go forward over the next 4 years. And you're going to also realize that some of them work really well and some of them don't really work that well. It's your responsibility to try to improve that. I vividly recall as a medical student working in the lab of Dr. Peter Knoll. Dr. Knoll was a pathologist, and Dr. Knoll was the person who realized that there was a small chromosome from one chromosome that had been moved to another chromosome in a subpopulation of people with leukemia. We didn't know what it meant. He didn't know what it meant. We were in Philadelphia. They called it the Philadelphia chromosome. You knew if you were a medical student in Philadelphia, it was going to be on the exam, so you spent some time and you thought a little bit about it. But then I had the privilege of watching over the years went by as people began to focus on this finding. And first, one group realized that when you took that little piece of one chromosome and you moved it to the other place, you generated a new protein that no one else ever had. Then they realized that that protein was actually a growth factor. Then they realized that that growth factor was the actual driver of the proliferation of the leukemia cells. And then all of a sudden someone said, well, let's block that protein. They made a drug called Gleevec that many of you will prescribe, and you won't even understand the tremendous significance of it. But Gleevec got brought to the market, and every one of us got to watch a disease that was a horribly impactful disease turn into a disease that we can treat with a pill. And that is a tremendous undertaking. Let me be very clear. Medicine is not perfect. Medicine needs you to keep your thinking caps on and to go through medicine and try to make it better and better and better as you go along. The last point that I want to make is that I want you to accept the mantle of mentor and teacher. Now, I know first year medical school, you're not thinking much about teaching, you're thinking much more about being taught and surviving and other things. But in a very short period of time, you're going to be in that role. You're going to be first a student, then you're going to be an intern, you're going to be a resident, and you're going to be in a position where not only are you being taught, but you are teaching at the same time. I encourage you to enjoy it, and I encourage you to take it very seriously because it is our responsibility to pass teaching on to the next generation. So let me just close by saying that today is really a wonderful family day. You're here with your families, and you just need to look around and see the joy and the love that's in this room for each and every one of you. It's truly a very special day. But you're also entering another family. This is the Warren Alpert School of Medicine at Brown University family that you are entering. And so in the next 4 years, please remember that the faculty, alumni, and staff are here for you, and that they are tremendously, massively committed to your success. Please accept their mentorship and guidance as the years progress and the challenges present themselves. Congratulations, class of 2021.
So I'm Daniel Eisenson. I'm a fourth-year medical student at Brown, and, and it's an honor to be here today. Welcome, friends and family, and congratulations to the class of 2021 on your white coats. This ceremony is an opportunity to formally celebrate your acceptance into medical school, which is a huge deal and the product of hard work and sacrifice through inscrutable pre-med classes, countless essays, and a grueling application process. For the PLME students, I want to congratulate you and your parents on your incredible foresight. You were way ahead of the game. You spared yourselves considerable anxiety. In addition to celebrating the remarkable achievements that got you here, this ceremony also serves as a formal initiation into the medical profession, with an emphasis on our commitment to the human side of medicine. I've been asked to talk to you about my experiences, quote, wearing the white coat, and quote, what the white coat has meant to me. Let me first say that I am not a model white coat wearer. I took it off at every opportunity and I never once washed it. The only time it was ever altered or cleaned in any way was after my friend, and this is true, took an aggressive bite of a jelly donut and sprayed the back of my jacket with red jelly. One of the nurses in the emergency department thought that red stains in an ER were particularly concerning and covered them with whiteout. However, the white coat, like the stethoscope, is one of the key symbols of the medical profession, and so represents our incredible community, privilege, and responsibility. Allow me to say a few words about my experiences with each of these elements of our extraordinary vocation. First, the community. You're joining an unusual group of people with a unified sense of purpose and deeply aligned attitudes who have all survived or are actively surviving the unique experience of medical school. 3 years ago, sitting in this church, I didn't know how important this community would be to me. Of course, you will have, as I did, a built-in network of friends who understand all the struggles specific to your level of training. You will commiserate as needed, trade bizarre and hilarious stories late into the night. But this community is much larger than your classmates and includes everyone up to the most senior attendings. I discovered this in my first year, reaching out to a neurosurgeon after a family member's spinal cord injury and getting an immediate call back at 11 p.m. We talked for an hour about the injury, pathophysiology, and prognosis. You're joining a community both in medicine and at Brown of compassionate people who see you as one of their own and who will support you even if you're a first-year medical student and it's 11 at night. Second, as a member of the medical profession, you have the incomparable privilege of sharing in the most intense experiences of someone's life. I know most of you have had some experience with this in your lives prior to medical school, but over the next 3 years, this will become a part of your daily life in the hospital. With your white coat, or more accurately, with your badge and a smile, you can go anywhere in the hospital and see almost anything. I remember sitting in your seats and hearing a fourth year talk about his obstetrics rotation and thinking abstractly, that would be cool to see, with no conception of what the experience would actually be like. As a medical student, you're primarily an observer, but you become indispensable to your patients and to any team you are on. For example, in my first delivery, I introduced myself to the patient and to her husband, talked for about 5 minutes, and then when it was time to push, I stood at the patient's bedside, looking at the monitor with the nurse, helping to time her pushes with contractions, basically saying, push, 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 and breathe for 10 seconds. When the baby looked like it was coming, I walked away for a second to put on my gown and gloves, and this woman I had just met screamed, "Where are you going? You can't leave!" Getting yelled at by someone in labor doesn't sound like an honor, but it's such a privilege to be there and to feel needed. From now on, even as a learner, you'll be an important part of the care patients receive when they go to the hospital. Of course, with this privilege comes an enormous and sometimes terrifying responsibility to help find solutions to people's most serious problems, to comfort patients and their families, and to instill faith and confidence in the profession. I know that each of you will bring empathy, kindness, intelligence, and integrity to this mission. That's why you're all here. 3 years ago, I remember wondering if that would be enough. Reflecting on my experience over the last 3 years, the answer is yes, it's definitely sufficient, but the best doctors I've worked with also fulfill these responsibilities with humor and humility. Humor first. The best teams I've worked on were led by attendings with a sense of humor. You're sitting there thinking, I'm not funny. Let me assure you that as with humility, the bar for humor is very low in medicine. The best doctors are by no means stand-up comedians. The funniest person in my med school class, a legitimate comedian and one of my good friends, is now in acupuncture school. Rather, the best doctors are simply willing to laugh. Not to downplay the seriousness of our responsibilities to patients, but to create a positive atmosphere and to make everyone more comfortable. People perform best when they're having fun. Moreover, patients and their families, even under serious circumstances, will want to connect with you through humor. I remember a case in which a patient who had been behaving normally developed a steroid-induced psychosis from his treatment in the hospital. Tasked with evaluating him over the course of the day, my resident and I were initially shy, waiting uncomfortably outside of the room as he incessantly chanted profane religious exhortations. His wife, seeing that we were uncomfortable, said, "Well, come on in, we're just having ourselves a revival." A sense of humor also includes, importantly, the ability to laugh at yourself, which leads me to my second point, that the best teams I've been on were led by doctors who were humble. They were humble both in how they carried themselves, and they were humble in how they perceived their roles in the lives of their patients. I want to say two things about humility. The first is that medicine itself is humbling. You can make an accurate diagnosis, suggest appropriate treatment, and still lose your patients. That's happened to me and will happen to every one of you at some point in the next 3 years, though your role as a trainee will shield you from absorbing most of the guilt. And the second point is that nothing, certainly not this white coat you're about to receive, separates you from the patients you will care for. For me, this point was driven home on an away rotation when an intern from another hospital became critically ill and was admitted to our service. It was surreal talking to her because I saw myself in the questions she asked and in the way she tried to understand the disease. A vivid reminder that we are all one random and unpredictable twist of fate away from the hospital bed. MD21, you're in a wonderful place, embarking on a career with a remarkable community, unparalleled privilege, and enormous responsibility, which you will fulfill with empathy and integrity, and hopefully with humor and humility. Congratulations to you and your families on your white coats, and keep them clean. Now it is my pleasure to introduce Dr. Alexis Hazen, who will deliver the Charles O. Cook, MD, Distinguished Visiting Lecture. Established in 1994 through a bequest from Mrs. Ruth Cook Peterson, the purpose of this endowment was to create a lectureship in a branch of medicine that holds the promise of significant and lasting benefit to the community, to the delivery of healthcare services, or to medical education at Brown. We are very grateful to Mrs. Peterson for her gift, and today we are honored to welcome Dr. Hazen to the distinguished family of Charles O. Cook lecturers. Dr. Hazen is the director of the Aesthetic Surgery Center at the Institute of Reconstructive Plastic Surgery at New York University's Langone Medical Center, and is an assistant professor of plastic surgery at the NYU School of Medicine. She also served as chief of the Manhattan Veterans Administration and Plastic Surgery. Dr. Hazen is board certified by the American Board of Plastic Surgeons and is a member of the American Society of Plastic Surgeons, the American Society of Reconstructive Microsurgeons, and the American Association of Plastic Surgeons. After graduating from Brown undergrad, Dr. Hazen served as an AIDS educator for New York City and served in the Peace Corps in Honduras. Upon returning to the US, she completed the pre-med program at Bryn Mawr College before graduating from the Warren Alpert Medical School in 1996. Dr. Hazen completed her residency in general surgery, plastic surgery, and completed a microsurgery fellowship at the NYU Langone Medical Center. At Brown, she is a member of the Advisory Council on Biology and Medicine. Please join me in welcoming Dr. Hazen.
Wow. I really can't tell you how exciting it is to be here today. 30 years ago, in May, I stood here and I gave the speech to our graduating class as a student. There were 2 students. And now, 30 years later, I'm sitting here looking at all of you. Wow. And I remember then, we felt very, very excited and very scared. And I imagine you are feeling a little bit of the same things. And your parents are probably feeling a lot of that as well. And it's completely normal. And you will feel like imposters for a long time. And then you will not feel like an imposter. And the humility that we've just been hearing about is something you're going to have to really hold on to. Because people will respect you and revere you very, very quickly in a way that is astounding, exciting, and exhilarating. And you're going to have to remember this day here when you felt like you knew nothing. In preparing for this, I surveyed all my residents and all the attendings and said, what would you want to tell, what advice would you have for medical students? What do you want them to know? Funnily enough, they said, keep your white coat clean. I got that one repeatedly. Then I got another one. Don't wear all those books and pads and pens in the pockets of the coat. Right now they're empty, but pretty soon you're going to start stuffing things in them, and you'll be like a bag lady. So don't do that. Then I had more serious ones. Find mentors. Be a mentor. Follow your passion. Do what you love. Don't do what you don't love. Listen to patients. Be open. Don't be scared to change your mind. So when I started as a medical student, I'd been in the Peace Corps, and I was pretty sure I wanted to do something in international health. I didn't know what that meant, but I was very sure I didn't want to do surgery, 100%. Those people were gunners, they were weird, they were competitive. I was like relatively normal, relatively fun. I wasn't a gunner. So I made that my last clinical rotation. Unfortunately, when I started my first day, my very first day, I was like, wow, this is surgery? You get to do this? Completely fell in love with it, and then had to kind of figure my way out and ended up going into an extremely competitive surgical residency program. And for that, I'm so grateful, eternally grateful. I've had the most amazing career. So be open. You may go in with a very preconceived notion of what it is you think you want to do and who you want to be. And guess what? I'm still not a gunner. So you can be yourself even within that field that is very male, that is very white, sorry guys. And you can find your place and be the humble person that you want to be. So other people talked about being problem solvers, thinking out of the box. Don't be scared. If you are scared of something, try it anyway. I was terrified about surgery. I mean, it's a pretty daunting task, but don't let that be a reason not to do something. One of the things a lot of people said is say yes to challenges. Stay late if it looks like you're going to learn something. Sometimes those nights in the hospital when you're the only person there, you're going to get to deliver the baby. You're going to get to see incredible things, and that may change your perspective in your life. And putting in that extra work sometimes really, really pays off. So one of the things I've had an incredible opportunity to participate in the past 3 years was a face transplant. A face transplant. So when I sat there 30 years ago, that did not exist. And 3 years ago, we started preparing, put together a team at NYU and started preparing to do a very, very complicated face transplant. Not like they're like the easy face transplants and then the complicated ones. And we prepped every weekend for the entire winter practically. We went down to Pennsylvania to a cadaver facility from New York, driving. It was like one of those things where it was always a rain, a storm, winter warnings, and we practiced every possible permutation of the, oh, my mom's calling. I should answer and take a selfie. Now I lost my train of thought. So we're practicing, yeah. And it was, the first time we practiced, we weren't so good at it. And we timed every aspect of it. So we were basically taking the face off of one cadaver and putting it on another. So it's cadavers, they're not, they're already dead. And then, came game time. And we'd done this so many times, but it had never been done. It was the entire scalp and front of, everything from here all the way forward. And it was a gentleman who was a fireman, and his face had been burned off, and he'd been living with really very, very disfigured, unable to eat on his own. His eyes were basically scarred shut, so he couldn't drive, he couldn't participate in sort of normal activities, despite having had 30 surgeries by renowned plastic surgeons all across the country. So that's what I mean when I say think outside the box. Think of when there are problems that you see that there's no good solution, think about something else. And then practice it, try it. Try it safely on cadavers. And so that's what we did. And 2 years ago, he underwent a 26-hour operation with a team of doctors, and it was completely successful. And now he can see, he can eat, he is driving, he is fishing, he is spending time with his family. And it was such a privilege and honor to be a part of that team. I spent hours and hours and hours working, hundreds of hours. I was not compensated for it. The entire team wasn't. And it was one of the best professional experiences of my life. So take those opportunities, put in the extra time. You will be rewarded for it immensely, and you will learn from it, and you will propel whatever your chosen profession is further and further. I never could have dreamed that would happen sitting in your shoes, that I would be up here telling you I did a face transplant. I mean, it's kind of insane. So a couple of things that rose to the top, and I'm going to come back to this, is to be kind. I'm going to presume that you are going to work hard. I'm going to presume that you will learn everything you possibly can to be the most proficient doctors that you can possibly be. To get where you are today, that's what you know how to do. And as people have said repeatedly, you're really privileged to be in this position. And you have a responsibility that is really unparalleled. You're going to have the opportunity to change people's lives, to save people's lives, literally save people's lives, and to change the world and make it better. You're also going to see horrible things, and you're going to have losses that will hurt you deeply. Right now, you probably don't feel like that. When I say you're going to save lives and you're going to change the world, you may be feeling like you're very, very small compared to what's ahead of you. But you're not. And there's something called the butterfly effect, which is based on a book that was written by Andy Andrews. And what the butterfly effect is, that literally every single tiny little thing that you do matters. I'm going to read you a quote. Every single thing you do matters. You've been created as one of a kind. You've been created in order to make a difference. You have within you the power to change the world with the smallest acts of human kindness. Every interaction you have with every single patient, every orderly, every nurse, every other doctor, keep that in mind. Whoops. Because you're going to have a lot of stress, and you're going to have times when you don't really feel like being kind, and you're going to have a lot of pressure. But literally, just saying hi with a smile, noticing. Keep your eyes open. Notice the people who are changing the bedpan. Notice the anxious, annoying relative that keeps on asking you the same question. Acknowledge their anxiety, talk to them, look at them. These are things that are so important to our profession and can easily get lost, especially the more stressful your profession and the more demands that are on you. Sometimes there's nothing you can do for a patient or their family, but just be there, listen, laying on hands. That's what we used to do a lot. Now there are so many options for cures and treatments. Then he was talking about Gleevec, I'm talking about a face transplant. These are, kind of insane innovations, but just be there, put your hands on the patient, hold their hand, listen to them, say you're sorry. Sometimes there's nothing you can do except be human. You're going to have challenges in dealing with people who are very much unlike you. It's really easy to be kind to someone who's kind. It's really easy to be kind of respectful of somebody who has your values. But you're going to have patients who don't have your values. You're going to have patients who have opposite values and who are really challenging for you. You have to rise above that. I'm going to give you a kind of crazy example. When I was in general surgery, I was on the trauma team, and there was a shooting at the Empire State Building. It was in the 90s, and the shooter and so the victims, there were 7 people who were killed, 45 injured, and the shooter shot himself but wasn't dead. They were all brought to the Bellevue Trauma and I believe St. Vincent's. So there we are next to a victim and the shooter. We got to take care of the shooter too. That is our duty, and it is a hard thing to wrap your head around. And that's a very extreme example, but they're going to be patients who you don't necessarily like and you don't respect their views, and you're going to have to take care of them. And that is part of the oath that we take. So I talked a little bit about being kind and being humble. One person that sometimes gets lost in this is yourself. So you really have to be kind to yourself as well. And that means a lot of different things. It means taking care of yourself like you would take care of your patients. So you need to try and figure out a way to do that. I'm going to read you a quote from the Dalai Lama. You may have heard of him. He's this guy. I believe that the very purpose of life is to be happy. From the very core of our being, we desire contentment. In my own limited experience, come on, it's Dalai Lama. I have found that the more we care for the happiness of others, the greater is our own sense of well-being. Cultivating a close, warm-hearted feeling for others automatically puts the mind at ease. It helps remove whatever fears or insecurities we may have and gives us the strength to cope with any obstacles we encounter. It is the principal source of success in life. Since we are not solely material creatures, it is a mistake to place all our hopes for happiness on external development alone. The key is to develop inner peace. So I think one of the ways to develop inner peace is to really listen to your heart. Find your passion in these next 4 years. Do your best, try your hardest. Be kind to yourself, be kind to others. Our world is very sick right now, and our country is very sick. And you are leaders of our world in a way to heal the world. You're all healers, every single one of you in this room. You all have unique and incredible talents and a lot of power that you don't maybe feel and you're maybe not aware of. But I want you, every one of you, to start harnessing that power in an effort to help heal this country and our world.
Thank you again to Dr. Hazen. And it is now my pleasure to introduce Dr. Philip Way, President of the Brown Medical Alumni Association. Dr. Wei is a member of the Brown class of 1982 and the Brown MD class of 1986. While at Brown, Dr. Wei double majored in biology and English before graduating from the combined medical program at Brown and Dartmouth Medical School. After Brown, Dr. Wei received his general surgery training at Northwestern, completed a plastic surgery residency at New York Hospital Cornell Medical Center, two fellowships in breast surgery at Memorial Sloan Kettering Cancer Center, and microsurgery at NYU's Institute of Reconstructive and Plastic Surgery. He is currently a partner and surgeon practicing with Plastic Surgery Arts of New Jersey and holds additional appointments as an associate professor of surgery and attending surgeon at Rutgers Robert Wood Johnson Medical School. Dr. Wei has been involved with Brown for more than 20 years as an area chair of the Brown Alumni Interviewing Program, board of directors of the Brown Club of Central New Jersey, and now board president of the Brown Medical Alumni Association. Please join me in welcoming Dr. Wei.
I want to assure you that a future surgeon followed by 2 surgeon speakers is purely coincidental. But I want to tell you that the Brown Medical Alumni Association is really proud to give you your white coats, and some of you may have found these little notes. They're very private, one-on-one, written by some of our alumni, some of our board members, and some of our parents, and they're for you to share with only yourself. So you're going to be seated in this church twice, one today and one in 4 years when you get hooded. And I can tell you that it's going to be a transformative experience, and in 4 years your white coats, although I also would agree that they should be kept clean, but they're not going to be that clean. They're going to, you might have slept in them, and they're going to have stains and blood and tears and maybe yesterday's soup from lunch. And, but just remember this moment, and you come from very diverse backgrounds, 30 states, 59 colleges, 16 countries, but this white coat is going to really unify you, and we're all very, very proud of you. So without further ado, I'd like to start with our very first student, Shannon Adams. So the first student gets the longest applause. She gets 2 applauses. Keep in mind that we're going to do this 144 times. So you can be loud, but be brief. Jesus Aguirre. Ronald Akiki. Aloho Akpovi. Alyssa Aldridge. Kelsey Anderson. Loreno Andrade Vicente. Adriel Barrios Anderson. Somitri Baruha. Julia Bassell. Giselle Bello. Godwin Bofel. Kira Bromwich. Melanie Brown. Vivian Chan. Danielle Charles Chauvet. Fiona Chen. Roy Chen. Adrian Chim. Alice Chu. Megan Cook. Victor Dang. Andrew Del Rey. Christopher Demas. Sophia Demunick. Emily Director. Jordan DeSaltos. I'm sorry, Steve. You're going to have to follow him on graduation, too. Stephen D. Maria. Maya Dinsmore. Cody Doberstein. Joseph Donnelly. Lindsay Dreisler. Jonathan Eckstein. Ryan Fallon. Julia Festa. Sarah France. Allison Froelich. Natasha Furtado Dalamba. Ashling Galligan. Catherine Gunnage. Roja Garamella. Johanna Georgakis. Elizabeth George. Soha Ghanian. Zachary Gold. Alyssa Gonzalez. Alexander Gould. Stephanie Guang. Scott Gummerson. Amelia Gurley. Christopher Helene. Laura Harrison. Davis Hartnett. Serena Heyer. Sarah Hayes. Chi-Hee Yi. Christina Hinman. William Hogan. Danielle Hollenbach Pringle. Katie Shaw. Thomas Shu. Sunmi Ha. Lindsay Kahan. Sanjana Kalagara. William Camp. Marcus Karam. Hannah Carmen. Alec Kinchevsky. Max Kitaj. Sarah Clare. Megan Kozimala. Nina Kavratskilya. I get it right? Michelle Kwan. Jeffrey Lamb. Christopher Lama. Charlotte Lee. Erica Lee. Sean Lee. Jacqueline Leong. Ruben Lesnick. Georgia Lipkin. David Liu. Kirsten Loscalzo. Jeremiah Lowe. Liliana Luna Nelson. Simon McCarthy. Patrick McClone. Julian Medina. Naman Mehta. Heron Manillo. John Milner. Kylo Moahi. Rose Montplaisir. Devin Morris. Matthew Neal. Todd Nguyen. Tobias Nicholson. Chibiquim Nwizu. Olabade Amole. Gabrielle Honor. Constance Panton. Pranati Panuganti. Karen Pabendorp. John Peranzi. Diana Ponitz. Christiana Prusnell. Boyd Q. Rebecca Raymond Kolker. Lauren Reedy. Olivia Ricabo. Helena Reagan Tuero. Karina Rivera. Chrissia Rivera Perla. Cleo Rochat. Stefan Rodriguez. Alex Rosenthal. Jack Rodell. Monica Satchar. John Sanderson. Brandon Scott. Kevin Simmons. Jameson Sneed. Ethan Snow. Carol Spake. Catherine Sullivan. Grace Sun. Sydney Tan. Kevin Tang. Nicole Tomasian. Jason Sickless. Harry Van Duzen. Erica Veazey. Elena Wang. Amelia Warshaw. Michael Wood. Pamela Yan. Lanbo Yang. Anthony Yao. Wenjung Yu. Michael Zaski. Kevin Chang. Olivia Ziegler.
Thank you so much for coming today to celebrate with us. Just a few quick announcements. Immediately following the ceremony, all students are to go back through the back of the church to Parish House for the official white coat class photo. All families are going to a reception at the medical school, so please head directly there, and the students after their photo will meet you there. Shuttle service, a couple other things. Shuttle service is available to and from the front of the church to the medical school until 7:30. And last but not least, I ask the MD class of 2021 to stand and applaud your parents and families as a thank you for their love and support. Congratulations.